I'm the Health and Human Service Chair. It is 6:07. Welcome, everyone. We're going to go straight to our presentation because of the fact that the new business we're going to push to the side. You want to introduce everybody? Okay. Well, we're going to start with introduction. So, my name is Marilyn Pena.
Marcelo Villagran.
Stephen Palmer is Community Coordinator from Bronx Community Board 1.
From Young Adults and Education. Claudia Rafa, Community Board Member. Christina Carter, Community Board.
Anthony Jordan. Oh, I didn't see you. Carol, you're hiding behind there. I didn't see you back there. Hi, Carolyn. Good evening, Madam Chair, ladies and gentlemen. Anthony Jordan, District Manager to the board. Please be reminded that our board meeting is being live broadcast on our YouTube channel. Please speak clearly, precisely, and before our recording devices, please introduce yourself for the recorded record. Thank you, Madam Chair.
Okay. What's the presentation?
Yes.
Okay. All right. So we do have Lincoln Hospital here today to present, and I'm gonna just give you the floor to introduce. And thank you for coming.
Thank you for having us in such a timely manner. My name is Dr. Melinda Lance. I'm the Chair of Psychiatry for Lincoln Hospital, and that includes all of behavioral health and the substance use services. And I'll have some of the team members introduce themselves.
Good afternoon. My name is Daniel Colon. I'm on the Dixon's Council.
Welcome.
Good evening. My name is Xavier Herrera, and I'm the Addiction Program Administrator.
I'm Rhea Broderick. I'm the Acupuncturist Wellness Coordinator.
Okay.
Hi, my name is Wanda Gonzalez, Registered Nurse, Addiction Services.
Hi, Wanda.
As you can see, we have a diverse interdisciplinary team. And we're here because we are seeking your approval for the relocation of the Lincoln Recovery Center from its current location where it's been for the last 10 years, or perhaps even more, on 142nd Street, located in Gotham, Belvis, in an unfortunate basement location. And we are planning to move it back here to Lincoln in a space off the first floor. And I'll show you the floor plan for where it will fit and where the hospital has identified appropriate space. We have the full support of our CEO and all the officers of Lincoln Hospital, from finance to HR to everyone. We've told our department that everyone is supportive of this, and we truly feel that it will enhance our ability to provide services. We could probably triple our volume in the first 3 months, to be honest with you. And we'll explain why that is. I can tell you that Lincoln Recovery Center, or what was originally Lincoln Detox, has a very rich history. If you worked in the field of substance abuse in the city of New York and even outside of New York, you know that history. I used it myself over the years, particularly the whole grassroots effort that brought auricular acupuncture and other complementary forms of care into the realm of detox and sobriety. It was very community driven. And our hope is that by relocating all of our services under one roof, again, we can regain a lot more of that interdisciplinary community feel. So I'm going to have Xavier tell you a bit about our ability to provide services, and then we'll tell you about how the move would occur and where it would lead, and how we feel why we feel we have so much opportunity to grow.
Yes. So Lincoln Recovery Center, we focus on helping people obtain and maintain sobriety from all substances, mood, mind altering substances. We provide individual and group counseling. We provide acupuncture. We actually allow for time and space for clients to be able to explore the consequences of their substance use and how it affects their family, their structures, their individual, and their belonging to a society or reintegrating back into society. We also offer the job training, education, acupuncture, as I said, coping skills training, domestic violence counseling, DWI counseling for clients who have been referred from past or alternatives for incarceration programs, service the LGBTQ community, and opioid overdose prevention. We're located on 142nd Street in the Belvis Clinic, Community Health Clinic, and we're open Monday to Fridays from 8 a.m. to 4:30 p.m. Intakes, we do them on Tuesdays and Thursdays all day long. We also offer drop-ins, so if somebody does not have an appointment for an intake, they could just walk in and we will see them. That's what we offer them. Um, We're part of the Office of Addiction Services and Supports, OASIS. We're licensed by OASIS. OASIS has agreed to allow us to move back to the hospital and to be able to treat more people. Um, I have worked for the ESPER team, which is in the, I started in the emergency department, the ESPER team, and then I moved into the catch team on the ninth floor. And now I'm at Lincoln Recovery Center, and I know firsthand that the number of people that we saw in the emergency department were not the same number of people that attended Lincoln Recovery Center that could benefit from those services. So we lose a lot of clients that we are not able to see because of the distance. We're also, the separation of these services, well, there are three programs or three services based in Lincoln Hospital. The part with the psychosocial services is a Lincoln Recovery Center. So we offer medication-assisted treatment or MAT here at the hospital. We offer the ESPER, which is referral for clients who are in the emergency department, or in the catch team, referrals for patients who have been admitted to the hospital, and also medication-assisted treatment from the Bridge Clinic, which is where Wanda is working. And so those three services reside here. While the psychosocial services we offer or treatment, the clinical component is at Lincoln Recovery Center. So that separation of services creates a major obstacle for clients. You know, you see 100 people that come to the emergency department or they're admitted to the hospital, only about maybe 5 or 6 people will make it to Lincoln Recovery Center. So that's a significant number of people that we lose because of not being under the same roof, services delivering under the same roof. The catchment area of the hospital and the Belvis Clinic encompasses the community that's bearing the brunt of the majority of the overdose deaths that occurring in this country. One of the highest ratings. So we think that being able to bring those services together will alleviate some of that, but it also provide a lot more opportunities for people to access those services being in the same building. That we could be referred directly from the catch team or from the ESPER team, the emergency department, directly to Lincoln Recovery Center for the psychosocial treatment of babies.
And just to give you some examples, if you could, if that's okay. There's a lot of metrics. I really want to focus on one in particular. If you see our ED teams, our ESPER and ED leads teams that see every patient who come into the emergency department that have a substance use related problem. Last year, 2024, they saw 19,000. So even if we could capture 10% of those 19,000, we would be again tripling our volume. And we're fully prepared to increase our staff, to increase our staffing levels, to add additional counselors, and the hospital has a commitment to do that once we start capturing more and more of these people and encouraging them to get their treatment right away as soon as they come off on the hallways. That's the linkage that we need. Plus, as David said, we provide a lot of heavy medicalized treatment here already, but we don't have the marriage of the social component.
Right.
So it all needs to be together in the same place. That's what it is for. And we certainly have the volume of patients who touch with and also we can show you the space. This is the first floor. It's literally around the corner. It's behind the cashier's office. It had been used for pre-surgical testing, and pre-surgical testing has been absorbed into other floors of the hospital that do preoperative care. And so that you can see the purple outline and all the space that will house food rooms, individual offices, consultation rooms, exam rooms, our acupuncture therapy room. Since Ms. Broderick here is up and running. And we'll be able to provide all these services. And this is literally down the hallway from the emergency department as well.
Good.
Yes, thank you.
So, do you want to ask questions? All right. So I will open the floor for questions. Anyone have any questions? Sure.
This might seem like an obvious question, but it seems so natural if that would be under Lincoln Center, the hospital. Why was it not in the beginning? Like, what separated it out at first?
Ooh,
There's a long history. Not always probably the best. But it goes back to 1970 when the Young Lords and the Black Panthers occupied part of the hospital.
The one on one, the
No,
detox center that's on one.
the 140, that's where they went after the hospital basically rejected them. So we could probably say that we've been in exile since then. Not back in the hospital because of that, political reasons and all that. But then they were, Lincoln Recovery Center that was located on 140th Street up until 2010. And in 2010, there was an offer from Oasis uh, to remodel that facility on 140th Street, but Lincoln Hospital did not take that offer. Instead, they wanted to be moved to Valdez Clinic. At the time, I think Valdez Clinics were part of another system, I think the Valdez system, and so they belonged to a different grouping of hospitals and clinics. But then that model changed a few years ago. And so now we're kind of excluded, but also part of the hospital at the same time, which is kind of bizarre.
It's interesting because I'm very familiar with that history. And
Yeah.
so much good came out of the Young
Yes.
Lords.
Yeah.
And that really helped New York City a lot for the hospitals, such as the HEPA rules and
Right.
privacy protection. So I'm very surprised to hear of being ostracized.
Right.
It would just seem, I thought the clinic was there because of the need there at the time. This is in the 70s, and it was just, this hospital wasn't finished or something then at that time, that they had separate buildings.
Yeah, which is not, they weren't welcome back into the hospital. I know
That's so
that from the
interesting.
140th, when they closed that facility, and moved us to Valdez, there were 37 counselors, and, 7, probably the maximum number of counselors that we can have around the area. So that was drastically reduced, but that was the hospital.
So it went to Dallas instead of coming into the hospital. It's a bit of shocking history, right? I'm really not, because the Young Lords did so much for helping and moving healthcare forward, but now to be used nationally. It's just surprising to hear that it would be separate. So thank you for the history. So I'm very familiar with that building, which will become the Arts Building, Health Education and Arts Building, for those in Lobby and celebrating that Young Lords history. So interesting how things turn.
Yeah,
But thank you.
welcome.
I have a question. So it's great that you guys offer an array of services. Do you use peer services, like peer type work?
Yeah.
Peer counseling, yeah, and integrated actually in every area of all of behavioral health. Okay. We use them in completely like the substance use programs, the ED-based substance use programs, Central Recovery Center, even our inpatient psychiatry units use peer. I think there is. We're part of the peer academy at central office. Right. And so we have training about the just for the peers. And they're integrated into the
And less is known about the peer counseling program that also started at that time, that really about Young Lords and the Black Panthers.
And, you have a question?
Yeah, I'm familiar with the operation. I remember when Nelson Rockefeller was governor of the state of New York, how he closed down all the state mental hospitals. Then right after that, he enacted the Rockefeller drug law, and that's what laid the groundwork for the mess we got today. And after what I heard Sunday, and what I observed every day was that a whole lot of these folks out here don't want no help. They have to be petitioning right now. Because I see all these, who's that, 27 drug treatment programs left down clinics in this particular district right here, right now. Then you got parole and probation down there on 134th Street and Lincoln Avenue. And then they put up the prison. I took the school from here before Bluebird took on Mayo control. Now I saw them take the money out when the child stopped failing the 3rd grade and laid the groundwork for the pipeline to the penitentiary. And when I walked in that penitentiary and seeing how anywhere from 30 to 60% of the population was on some kind of drug, I said, this is it. So I talk to these fellows out here, and some of the they enjoy what they're doing, even when they hit rock bottom. Because they telling me this, straight to my face, it's hard to do the right thing. Even though I appreciate what you did. Well, she says, I feel it took a while for I have reached the conclusion that just maybe, except for those who really want to write this generation off and go out the door in pre-K and kindergarten, can't film education about you have a choice. You gonna go out there and do what you're supposed to do, then you're gonna get caught in that trap. So I did what I had. No, do what's supposed to be a positive contributor. Because I was born and raised in this particular section right here. Since, boy, old PS9 on 103, a lot of people forgot about this shit. And even on PS31, 450, 6th grade. Matter of fact, I even walked through Bill Clark. And 139 was all female. Well, getting back to that right
Yes.
there, I appreciate what you all did.
Thank you.
And those who want to get help, I support you with it.
Oh, okay. All right, that's what we want to know. Yes.
Thank you, Chair. So a couple of questions, and what we didn't have here, we didn't have a dollars and cents. So we talk about that the footprint of the former Lincoln Recovery Center is a fairly larger footprint, and you talk about having the largest staff. But then you have, we're walking back now into almost an 80s epidemic of opioid and other heroin drug use. Given now that the space seems particularly the footprint seems very smaller. Let's talk about what is the staff numbers associated to this program? Are the numbers going down since it's moved up across from the 140th Street site to Belvis? Is it still low, or is it baseline coming out and moving into this building?
Well, this is the current Lincoln Recovery Center staff. It has been the new baseline for 15 years. So that's what I inherited when I came a year and a half ago. The good news is the costs of the move are relatively minimal because it'll all be done in-house, and very little items will actually be moved. And there's a fair amount of infrastructure, particularly electronic equipment, computers and things already in that space. So it really will be a refresh of painting. We'll be using healing and arts artwork. Rita was asking about that. And we'll be redecorating.
What's the number of staff? Like how many staff? How many clients you hope to see? What's your operation hours? I saw that I guess Monday, Friday, 8 to 4. Given the reality where we are with the, I know that the dollars is oasis. I know the governor Hochul just recently allocated the $600 million associated with. So I want to speak to the numbers, the weeds of this move.
Sure. So we are just polishing up some of this plan. In fact, I don't think even Xavier knows all of it. We do have a pipeline to some of the opioid settlement money and the Centers of Excellence money that comes from Governor Hochul as well. So with the plan of wanting to gradually go up to tripling our visits, we can support already an additional 3 counselors really within the.
Which brings you to what number?
10.
What clinicians? We have about 5 clinicians.
5 clinicians that are KSAC, KSAT, whatever.
Everybody's KSAC.
Oasis KSAC. Okay, I'm sorry. Continue.
So we can add an additional 3 and making sure that we fill any vacant lines. We also would like to add at least 1 more peer, because peers come from the peer academy, and we have special funding just for them. A lot of it is just optimizing the staff that we have. We already have addiction medicine, hiring an addiction psychiatrist with differently other opioid settlement money. That'll be based in the hospital that will provide the medical backup services for the recovery. And we also have a nurse practitioner and other staff. Because they were in different sites, even though everyone was working very hard, they were complementing each other really. We have business plans that can support, once their visits double, we can again add an additional 3 counselors, so it will be a phased plan. We will then have to start looking at space. But down the line, because probably a year and a half from now, we'll be back about the plan to then relocate this service from the 1st floor to the 6th floor, and the Rise Center and the new modern Lincoln Recovery Center combined Catch and Bridge facility.
And in this space also you have acupuncture. So how many acupuncture counselors how many?
Yeah, just one
now. How many? Because I know there was a large part of the services of adding acupuncture not to addiction, not only for opioid or other related, but also smoking cessation and other. Is that something that's still going on now, and how many are associated to that?
Well, it is going on now. What we're doing is 3 days a week, the days that the patients are here having all their group meetings and what have you. They usually come in right after that for treatment. We do have on schedule another time slot as well. And the way I think I could fashion it is on the hour, it can be offered. And eventually I can train people, counselors, anybody that's interested in administering acupuncture. And I can supervise them, then, sky's the limit and how many people we can treat during that time. That same room that I'd be treating in also functions as a group room.
So when you say group, was that relapse prevention, NAAA, trust up meeting space, et
Well,
cetera? What
we
is
have a
that?
community NA group that takes place in Lincoln Recovery Center, and they probably will move in with us here, but that's a community group. The groups, the clinical
When you say
groups,
community group, what does that mean? What would they be doing over the service?
it's open for the community. We don't organize or facilitate those groups. Those are, the community's in charge of those groups. Yeah, and they happen every day.
Community could be what? The community board could be a nonprofit organization, like, nothing
It's
specifically.
members of the community.
Members, okay.
Yeah.
So they're not identified yet.
No,
Okay.
and they're not necessarily clients of Lincoln Recovery Center. They could
Right.
just come from across the street, from the next block. They come for those meetings. They don't need to register for that. It's just like any other AA or NA meeting in the city. But we house them in Lincoln Recovery Center.
So would you say that the program grew in space or contracted or is that small or in space since it's moved from the Velvet Center here in this temporary space, and then the idea to eventually grow into a whole floor or wing? Is
It's
that
going to be a wing on the 6th floor, so they'll be temporarily downsized, although we're very skilled at creative use of space, and we do stagger offices, and we stagger groups and programs across our whole department if we need to. But then they will again grow because the 6th floor footprint will have more spaces.
what's the timeline to
Well-
all of this happening?
This is a minor refresh of a space that's already empty. The 6th floor is a major construction project. So for that whole Rise Center plus the new LRC, we're talking about the end of 2026.
Let me tell you my line of questioning, because I think that it is an all hands on deck approach to this, and I think that what is happening is that we have this committee has specifically been evaluating all of our mental and medical health facilities from On Point near to Samaritan Village to others about what is their contribution to eradicating or at least working with our brothers and sisters who have been unfortunately become victims to this epidemic that's been open drug use, harm reductions, syringe exchange, 12-step traditional stuff. I come from that world, so I understand how beneficial it could be. But we are, I guess, the borough president and others have said, in a state of emergency. As you see, you can't work here or live here and not know this community does need a radical plan that's necessarily not always in the box, but to be able to help our brothers and sisters who are facing this issue. And like one of our community members, Mr. Francis, talked about, sometimes you have folks who are addicted to this, who are not ready, and so it kind of like your program of the 12-step tradition recovery piece becomes almost the last alternative for people who are trying to get off this issue. We have so many other things out there, the methadone clinics, and the other programs are out there to help people who are dealing and battling opioid or heroin use addictions. And so, but it is essentially important because it is a gateway to allow people to reunite themselves with families, to go back into society, to do a lot to this. So I believe in it because I've seen it change and turn lives around, reunite families, and so on. But I'm this concern and our responsibility to look at the dollars about how are we really using these dollars that are coming from the state and what the federal government is looking at doing with this issue.
And provide
To have-
clarification.
And clarification to make sure that it's happening. So our concern is to ensure that this is that the best resources and the best people are being put in a step forward, and that we're have the best plan in place to ensure, because the hospital has essentially a lot of resources. Sometimes people who are addicted to this don't even seek medical attention. They haven't been to a doctor in years. So there's so much that can be happening. So I'm just want to make sure that your dollars are being used to really make the strongest impact possible to And if so, how can we as advocates on the grassroots level be working to be as radical as the Black Panthers and the Young Lords to be ensure that you guys have those dollars? And that's our job as advocates, chief advocates, and budgetary advisors to the city hall, but also to the borough presidents to make sure the dollars are there. And so I wanted to see that was unfortunate, but that the space is so small right now. But I was told to learn more about what the timeline means for you to push forward because the time is now.
Yeah.
The space is now. Everybody now, and so and I look at the numbers. I'm surprised that the numbers are so low. People who enter the ER on subsidies, but I take it because most of them don't want to go into to seek medical treatment. So that's what happens. I'm sure the number is this number here. While I understand it's reflective of who comes in the hospital, but it doesn't mean what's out there in the street.
Right.
And so I'm just interested about how the timeline is going to be to move you guys forward to meet that need, and what are you aggressively over the years? Because you guys are one of the oldest, for the 70s, oldest facility that's working on substance abuse. How are you radically from lessons learned using those lessons learned to be able to really meet this issue head on? Because we're going back to the 80s in my experience, and so I just wanted to get those thoughts.
Yeah,
One of the biggest.
What's the youngest age? What's the youngest age that person can come into your particular? What's the youngest age? 18.
Although,
Because
But Mr. Franks, I want them to stop from my question because I don't want to.
okay, I got something else to add.
Sure. Okay. Thank you.
although
Right.
once LRC is back and established, we do plan, we want to hire counselors with a background in adolescent work so that we can get OASIS certification for 16 and up at a minimum. There's another certification for 13 and above. Okay, we have to phase in with 13 to 16 to then go to 13. The other thing is that's very valuable real estate. I know it looks small, but it follows the rule of real estate. Location matters more than anything else. That's prime location. People are jealous that we're getting that space because it's such a great location. And so, yes, it might be busier. Yes, the offices won't be as big, but we're in a place where we will be able to see the patients who, if there's even any like glimmer of hope that maybe I should check this out, maybe I should try it, it's going to be down the hall and into the open door.
Because I want to because my thing is that if somebody says they need help, you got to.
For them to be able to test what they're taking. So that's the point of the fentanyl and the xylazine test strip, so they know what they're putting into their bodies. So basically, our mission with all of this is that we want to be able to provide easier access to the harm reduction supplies, and not necessarily inside of a program. This is just, I added how to use Narcan in case people didn't know what Narcan is. And that's it. But I'll go back to just what it looks like.
Thank you.
That's short.
No, that's informative. I'm gonna open the floor for any questions, comments, concerns.
Okay, I have a question.
Yeah.
So you're saying that you already have these in facilities, outside of facilities already. So how's that work? And do people go in there and do people try to take it without like needing to use it? Like what has been the experience so far?
Yeah. Oh, that's a great question. So far we have them in our Buffalo and Dunkirk locations, so upstate New York. They're highly utilized. So we go through, I believe in the 6 months, we went through 1,500 kits. And so far we haven't had any like vandalism or people breaking into them. But what matters, as said to us, and if that does happen, we can call them, they'll replace the machine or repair it. And they said, worst case scenario, we have a bunch of harm reduction supplies in the community. So there's no money in the machine. It's you go up and you enter your zip code so they can track what community they're using it more. And that's it. There's no money going in.
What about kids though? Like if like my concern is, young children going up to this machine and trying to access whatever is in there, even though,
Right. So for us, we're going to have them outside of our clinics with security cameras so we can monitor. Some of the other programs, they put them at convenience stores where they don't have as much monitoring, right? So for us, we want to have it outside of our clinic so we can watch it a little bit more. But as far as access, is there any issue? The xylazine chip is just a piece of paper, so that if a child has that, I don't see an issue. But
right, the three main contents within the machine. There's no harm that can come to the individual that uses it without reading it. So Narcan also is a medication that it reverses opiate overdose.
Right.
So usually when I give presentations, the analogy I give is like a game of musical chairs. So the chairs are the receptors on the brain, and when somebody takes opiates, then all the chairs are full. The Narcan comes and displaces the individuals off of the chair so that the person can breathe again and be able to get to a hospital for intervention. If you have not taken any opiates, the Narcan has no effect on the body. So you can't overdose from Narcan in and of itself, and no harm can come to that. That's why even, sometime last year, the year before, there was that unfortunate circumstance of a child in a daycare center. If that child had gotten Narcan soon enough, the outcome could have been different. And even if that child had not taken any opiates, if you give them Narcan, it will not have any ill effect on anyone's body. So that I believe was intentional with these vending machines to make sure that there's no harm that can come to an individual that takes them without needing them. And then the xylazine and the fentanyl test strips are to test the drug supply, because studies have shown that when individuals test their products, if they know what's in it, sometimes they utilize it differently. They may use less, they may choose not to use that product. There's a lot of unintentional drug use because the products on the street are laced with so many different things. So really, this is about informing the community, informing the individuals, so that they can live again another day to make a different decision in their life. So when they're ready for treatment, we'll be there for them to access it.
Thank you, Chair. So glad to know that, so how popular has it been in Buffalo and other places? Is this issue?
Very, very popular. So we have to refill them every time they're low. We have to do the refill. And like I said, the first 6 months we had to refill it. It was like 5 times. We were expecting, twice every other month, or something like that. And it's been monthly, sometimes more. So what we do is Matters will ship us the supplies of all the test strips and everything, and then we just fill the machine as needed. So it's been really utilized upstate, which is why we want to bring it down to the city. Initially, Matters was only in Buffalo, so they extended to let us go into Dunkirk, and now they're expanding throughout New York City, New York State, and into Pennsylvania and New Jersey. So we're going to hear their name more, which is great. So I did bring one of their flyers with their website. You can anybody can order harm reduction supplies through their website, individual or an agency. So they're really trying to get the service out.
Who owns or maintains the machines? Is it Apacia or the organization?
Yep, the organization so technically we're the host of the machine, but the machine maintenance and everything is done through Matters.
Now, only thing that's in the machine is the test strips and the Narcan, not needles.
No.
That's important. And in order to access the machine, I will have to be a client of Acacia Network Programming, or I'll have to be Jay or Joe Nick Bone in the
Yes, anybody. It doesn't have to be a client of ours.
And so, what are the impact or the effect of, what opioid fentanyl does? What is the impact of the other drugs? Is it similar or more potent, less potent?
Well, it's a different compound. Xylazine traditionally is a veterinary compound that's used to anesthetize horses. Initially, so it's horse tranquilizer. So yeah, some people refer to it as tranq. I think the first place that it sort of took off was really in Puerto Rico. So Anastasia de Caballos, the horse tranquilizer, was utilized for decades. And what it does is it potentiates the high of the individual that's taking the substance, so it makes it last longer and a higher effect. And the thing about xylazine that is very challenging is that it does not respond to Narcan because it's not an opiate. So you can give someone multiple doses of Narcan and it won't reverse the xylazine overdose. So it's challenging. It also causes wounds on the body, which can be difficult to manage and deal with. That's why it's important for the individual. Many individuals don't even know that that's being put into the product that they're using. So that's why the xylazine test strips are so important for them to be aware that this is what is in it. And many folks have gone back to their dealers and said, look, I don't want this. I will go to somebody else and get a different product to utilize.
And so, have you guys field tested some of the drugs that are being sold in our communities?
Field tested
meaning that when the necessity of this being here is because obviously you're saying this is being traced in some of the drugs that are being sold. So have you guys has your analysis on why this is needed in certain communities? Because field testing, some of the drugs in the community have these ingredients in it.
Absolutely, absolutely. And we personally, we don't do that testing. The New York City Department of Health does that testing, and there are other organizations that do have drug checking machines on site. We have not dealt with that just yet, but the data that we receive from our partner organizations from New York City Department of Health shows that much of the product on the streets in this community and throughout the Bronx have these compounds in it, and a whole host of others, which is very concerning. That there's so much being put into the supply today. That it's more important now more than ever to make sure that folks are aware of what it is they're utilizing.
And so the example, so you're looking to place one machine at this location, and then how are you evaluating the impact of this machine?
Yeah, so we're gonna be able to track the data of who's accessing it, so we have to put their zip code in, like that. They might use, just the clinic zip code, which is fine, but we'll be able to see how many people have actually accessed the machine. We're gonna track how many supplies we're giving out at that machine, so we know, if we come back in 2 months and it's still full, then we know that we're not doing a good job of advertising it, so we'll be able to track that.
What made you decide to use this location, given that the multiple locations and that the state of emergency, in my opinion, is at, and that a counseling program is already at?
Yeah, so we're actually going to be rolling out 3 machines in the New York City area. One at our program in Brooklyn, Carlos Pagan, one here at Ramon Velez, and one at our Clay hub. So 1776 Clay. We have detox rehab, residential youth, residential adults. There's 5 or 6 programs in primary care. So we're going to put one there as well. So we'll have 3 machines launching at hopefully around the same time, so we can then see the impact.
In Buffalo, when this is used, did it show that more people were using a substance, given the fact that they can test it and then be able to have access to using it, or was it still to show that you were saving? What did the data show? Was it saving lives or potential overdoses? What was the data showing?
Yeah, so we didn't have data of what people do with the supply once they receive it. So it could be that someone's taking it and storing it at home, in case they need it in the future. So yeah, we don't have that type of data. I do know with Matters, if they scan that QR code and they say they want access to treatment, Matters does a 30, 60, and 90-day follow-up. That's very, very new. So I'm hoping that will help us to see exactly what you're saying. What is the impact of all of this? Like, are we actually making a difference, or are we just giving people things to? Yeah, exactly.
Right. Because I saw something recently on social media where, and of course, there's people who are unfortunately facing an overdose and use Narcan. They're very pissed that you saved their life, and they're like, you messed up my package out. They use those exact words, but they say you messed up my package, and that is unfortunate reality of that we have in the community. I'm just trying to figure out, how do we, if this is something that the board agrees, how do you guarantee safety? How do you ensure people are not selling or misusing this in an unintended way, and unintended consequences to it? But and whether or not before the full board meeting, we share whatever data that would show that if it correlated that it helped to, even by one additional likely death associated to overdose. I also know that I'm a data person, so that's going to be too, because that will help us understand whether this is another tool that can be used to at least, if not prevent people from using it, because it's not used for that, but it's used to, obviously, what I'm understanding is to save lives. And so, and what communities, and at least in Buffalo, it could probably be used in 7 different places in Buffalo. I just want to know what the data is saying as we look at dealing with this issue. Thank you, Chair.
So I just have like a comment, question, not really a question, but in regards to the machine, will you guys be able to have a waste, or how is that gonna work? Like, anyone is gonna get the item, and how they're gonna be able to just toss it at a regular trash can, or will you guys have like a waste bin?
Yeah. So wherever we set it up, so where it is in Buffalo, we have the machine, and then we have a large container next to it. So if they're using it right there, they can throw it, because it does come, the Narcan kit comes in a box with 2 doses. So, they could open it right there and then just could toss the box. So yeah, we can definitely put some kind of trash.
All right, and And that's pretty much it.
So I just wanna go back to the kids.
Yeah.
So can you walk me through like a kid, cause that, there's facility, there's a lot of there's a lot of buildings in the area, there's a lot of residential, homes and buildings, and, kids could be curious and they're gonna, go up to it. Can you explain to me how, like, can you walk me through what's gonna happen if a child is trying to access the machine?
I mean, so if it's during our operating hours and security is on site, they monitor, they could do a foot patrol around the building, so, they could just ask them what they're doing. If it's a young child, I don't know that they'll be able to reach the keypad to enter, because you have to enter in 3 the consecutive numbers. But, again, though, if they are accessing it and they need it, maybe it's for a parent or something, and, I understand the concern, I'm not sure though how off hours, we're not gonna be there on site, so, if we look at it in the reverse of, like, if
Because you said there was a camera.
Yeah, we'll have a
Right.
camera.
You'll have a camera, so is that camera being monitored and,
during the day.
but then off hours, like during the weekends, what's gonna happen?
Yeah, so, yeah.
I mean, all hours, the camera is still recording, and that footage is reviewed periodically. So if we found that there was an excessive amount of children just going to the machine, we could sort of rethink the positioning of it. It's meant to be, by design, it's meant to be fully accessible to any and everyone, to make it as easy as possible. And we haven't had, that issue of children accessing it in Buffalo. Although, like you said, that particular community by Ramon Blez is a lot of residential properties and a lot of schools also within walking distance there. So it's something that we'll monitor.
Yeah.
But again, the fortunate thing is that there's no harm that can come from usage of the product, even in large quantities. It won't have any effect if they have not taken any kids. So we'll have to monitor that and look at that just to make sure that the products are being used for what they're intended to be used for, even aside from harming anyone. We want to make sure that they are effective.
Just for clarification, I know I see the image, but just so that I can be on the same page and I think the board as well. The machine is going to be placed exactly where? Is it outside by the gate, or is it going to be where the entry way is at?
So we have to look to see, because we might have to install like some plugs or where the camera is, so we haven't decided exactly where. This, when we shared the notification, it's early, they haven't even ordered the machines for us yet. So I just we wanted to make sure that the community was aware of what we were thinking about doing before we were doing it. So
because you guys are like kind of in the corner, and then you have all the other, you got a nonprofit organization across the street, which is Bronx Works and HRA and all that other stuff. And I just wanted to know, because I know that street is not really level. I've passed by there a lot of the times, and if you get what I mean, it's all cracked up. So I wanted to just know where exactly are you guys going to place that, and if there could be like a follow-up in regards to, just to give us a sense of aware of where you guys are going to have that.
Yeah, once we
machine at.
figure out, we can definitely give you like a map and then mark it where it is.
Right.
We're trying to put it on our property, so there's no issue with it being on city property.
Because you guys are kind of weird in the cut.
One additional question, Chair, is the machine, has the analysis been made of what is the average age or education level of someone who could be with access to the machine?
I can ask if Matters has any of that data. I haven't seen it, but I can definitely ask them.
Because if we're thinking, as our colleagues who are asking about children have access to it, if it's like you have to, if you have it in a way where you have to put a kind of a code and then scan, and then make a multi verification prompt to determine the likelihood of a young person being able to have access, even though there is no.
Yeah, but you guys are next to the park. So you guys are right next to the park. I know that very well. You guys have there's also a daycare house there on the corner. And so it's more of the concerns, because it's like the what ifs. Like, what, we don't want to attack you with these questions, but it's the what ifs because of the area and the population that's there.
And then it doesn't, and then like you said, that you're as a medical professional, you're saying that like it has a non-likelihood of having any negative medical impact on it we're not talking about what the possibility is of that possibility. Is this the stigma of those who in the community want to have something to likely point out to say, you're having this, you're glorifying the use, you're doing something that is not in a moral point of some people who live in the community, but if you had less availability for young person at a certain age, even though young people use, unfortunately, are impacted by opioid and drug use too. So we're not gonna that fact. I'm not idiot to that fact, but we want to make sure everyone can have access to it. I'm just saying what are the precautions that are likely the organization is looking at to ensure that a kindergartner can't do it, but a kindergarten can help save somebody. What is the possibility of that? They can have access to play around with it because all those things are so important to have to ensure that and for someone also who may be a drug user won't have ability to abuse it in a way to use it in a way that's not what it's not intended for, because I think the possibility of it.
And also providing you the support too, because I know that once you decide to put that vending machine there, there might be a possibility where you guys will get some form of protesting, because they're not fully educated or informed of what you guys are gonna face. And so we just want to make sure that we're on the same page, but also the what ifs. As parents, we're concerned, but we want to make sure that we're informing the community the correct way. So I just wanted to just add, because there might be some protests in regards to that. This is your trial and error.
Right.
So yeah.
Yeah. Does the packaging, once you get it, is it bilingual inside, or does it have, the diagrams that make it sort of universal?
Yep, so it is. So this is actually, oh no, sorry, I only put it. So this whole card is in English and Spanish inside the kit.
Inside the kit
Yep, and
itself.
also on the test strip pack, there's a QR code that gives them the instruction in English and in Spanish.
Okay. And just in terms of everything that's been brought up, which I think is really smart, perhaps it's worth investing in here in more of a, where you're near a park or near a school, is on the side or against the wall, just having a poster that says, this is what this machine is.
Yeah.
That there is not distributing
Yeah, the
drugs,
stop
but
sign
actually.
Right.
For those, many people are familiar with, harm reduction, but not everyone, right? And that could really help with any sort of, well, wait, what is this giving out?
Right.
Just a thought. Thank you.
Okay. Thank you so much.
Thank you. So this for the board is that they're not asking for a letter of support, but it's recognition that you met with this committee and that you this one to remind you that the full board meets here in the hospital in the auditorium on the 27th on the last Thursday of the month. It'd be amazing if you can come to the public session and do a 5-minute just talking point about what you're doing, because it allows not only for YouTube now people, but for the broader community to have a clear understanding of your work, understanding the great work that Acacia Network is doing to help improve the social, mental, medical health of our community.
And possibly joining again for a future presentation in regards to your to what you have around in the Bronx and what you provide, because that is important. We do have a community that's very outspoken, and we are trying our best to provide clarification, but also inform the community what organization is doing what. Thank you so much for your time.
One more question, sorry. When do you plan on having this machine installed and there and running?
Yeah, so we don't have the date yet. They were saying if we order it, it could take like 1 to 2 months. Our experience upstate was it actually took 3 months for us to order it, install it, and get the cameras, everything. So I think conservatively we could say by April, February, April, or May.
Yeah, sure. They'll follow up with
But
us.
I'll let you know.
Yeah. Thank you so much.
So thank you.
Thank
Thank
you.
you for the opportunity. We appreciate it. Thank you.
All right, we have the next presenter. Okay.
Sí, puede cambiar. Sí.
Alright. Oh, I was just waiting for it. All right. So the next presenter is Power in the Shower, Walter Harris. And they're requesting for a letter of support for public funding and seeking support for the members of the Community Board 1 and serving the homelessness and unhoused community. Welcome.
Thank you.
Thank you also for coming. Thanks for your time.
I want to thank the board for accommodating us at such a short notice. I think I sent some correspondence last week. It got lost and in a short letter from somebody from Community Board 4 sent to her yesterday. I called and somebody will work a miracle because I'm sitting here this afternoon. Kind of odd being on this side because normally I'm on that side asking the questions to the folks over here. After serving for 9 years on Community Board 4, I shift in 2020 just during the pandemic and diverted my time to this project. I'll tell you exactly as it says, pouring the shore. Most people look at it and say, is it a car wash? Is that? It's exactly what it is. It's a shower. It's a mobile shower unit. I'll tell you, my organization.
Have the clicker, right?
Yeah. And my background have been in community outreach and involvement. I'm a contractor by trade. Served and community advocate in advocating for those in need in our communities. Some years ago, I voluntarily went on the streets of New York and lived with the homeless. Back in 2006, 2007, with the intention of trying to understand what the needs are. And during that time, I found out that it was easy to just get almost anything that we wanted, food, we get clothes. I even met a guy who told me what his retirement plan as a homeless guy. And I was kind of stunned by that. But after a couple of weekends of hanging out with the guys in the parks and the different areas and stuff like that, I realized that one thing that we were not able to get was a shower. And I kind of promised myself that, sometime in the future I would like to do something to change that. Didn't know how I was going to do it, but forward some years later, my church organization was willing to do something about it, and from that, more needed to be done. And so in 2019, we rolled out the first truck with the Showers of Blessing in Manhattan. In 2020, I formed Power in the Shower, rolled it out in 2021 in the height of the pandemic when showers were scarce. All of the indoor facilities were closed, people couldn't get showers, and we built it and put it on, start working. Pretty much, I'm going to show you the next slide. Okay, I think we missed. Okay, there was a video. I guess it didn't download. Okay, there's a video file that shows a lady who was put out by her daughter just about the second day we rolled out in New Haven. We have served in New Haven for the last 4 years. Just a quick story about that. They picked us up. We came up with it. Somebody saw it, liked it, and the New Haven government, mayor, and their board picked us up, sponsored us, and so that has been our testing ground. As we were serving, one day this lady came down and was just in disarray and met us. We spoke to her, and the video would have shown her journey of coming off the bench and walked to us, and we talked to her. We assured her it's going to be okay. She got a shower, got clean clothes, and we were then able to refer her to a caseworker. And that is one of the things that we do as an organization. We don't work in isolation. That's what the difference between what we do in Power in the Show and what my church does. We are a community collaborated organization. And so we work with other entities to provide a stepping stone for the homeless and the unhoused to get back into and to get back on their feet. Now, most of you here are either coming from work, have a long day, and is looking to do 3 things when you go home. Eat. What's the next one? Take a shower. And the next one? Go to sleep. Now, When a kid is, if you want to hear parents, you have a child, there are three things that you do when a child cries. You check to see if they're clean. You check to see if they're hungry, and you check to see if they're sleepy. That never changes your life as you grow up. A guy on the street does not want to be dirty most of the time because he wants to. He has no choice. There are very little options for them to take a shower. In New York City, there are a couple of walk-in centers, but you have to have documentation. You have to be able to give IDs and whatever it is. Most of these guys do not want to conform to society's rules. But that does not prevent them from having a shower. And so our organization specializes in shower and hygiene and have seen over the last 5 years with surveys that have been done, how transformation from a shower brings guys back on their feet, back into their families and back to working. Stats have shown us that. This is changing lives one shower at a time. That gentleman was one of our first recipients, the first day that we rolled out, not the tall one, the short one. And no, the tall one is not me. And most people look at it and think that, that's not me, that's the guy that works with me, that runs the operation. And that gentleman is now back in housing, functioning, working, and he comes by every year to say thank you because of what we were able to do for him and our collaboration of supporting them getting back on his feet. Our program is set up that from the time you approaches us, we are prepared to deal with whatever it is. You had a bad night, you just had a high, our staff knows that we don't argue, we don't get confrontational. We're here to diffuse it, to get you to get a shower. And one of the things I always say when I'm there, if you take a shower and you come back out with a bad attitude, you got to go back and take another shower. After 5 years, we haven't had anybody have to go back. As bad as some guys were kicking before they went in, when they come out, the attitude changed. They apologize. They're sorry because shower transforms lives. And so our main aim is to meet them where they are, and that is why we are a mobile unit. And so we move, we collaborate, and we provide the service. Okay, to date, we have provided over 7,890 showers. Care packages that we give out, and there are people who are unhoused, not homeless, but unhoused. They live in their cars, their RVs, and some people live in rooming situation. We do provide care kits for them. We give them a care kit. You come and want a care kit, you sign. The way our program sets up is that everybody signs in. You write your name, and that's it. Well, we got to know whatever gender you want to put down. If you want to put male, female, X, whatever it is, then we go by ethnic group because we're able to know statistics, how much we serve ethnic group and stuff like that. And the rest of it just says, what do you want? Large t-shirt, small underwear, socks. Everybody who takes a shower with us gets all brand new underclothes. That's one of the things that we pride ourselves in. That's what hits our cost. And I have been pretty much in the New York area, fund this in New York when we do it here in New York. In New Haven, we are sponsored by the New Haven, the city of New Haven and Home the Services. But in New York City for the last couple of years, it has been sponsored by Out of Pocket. Everybody gets a t-shirt. Everybody gets an underwear. We are a distributor for Bomba socks. And so Bomba gave us every year, they started giving us socks. So that has been an awesome help to us. Everybody gets a package. Where's the package? Everybody gets a package when they come to us. This is the kit that we give to those who are, not really taking a shower, but they need some. They live someplace. We give them that. Everybody comes to us, gets a package like this. Sometimes we got to. It's pre-packed before we get to our site, and so it's already packed just like that. Sometimes we might have to change the underwear from a large to a medium. We just split it out, we put that in it, and that's no problem for that. But we're here to serve the people. So if we have a large underwear and you look big, I had a situation sometime last fall in New Jersey, and there was a guy who came. He was pretty much a 3X in size. When I saw him, he was a 3X in size, and you know I pulled out the 3X. That's what he wanted, but he said he wanted a large underwear, and I kind of looked at him and kind of like, how could a guy be 3X and this? But I don't question. I pull it out, and he kind of looked at my face and kind of like I was kind of confused until he pulled up his he said, I am big up here, but I'm small. And I said, that is why we are always prepared to meet the needs of whatever the folks ask for.
What's this white part? Is that the towel?
That's the towel. It's a disposable towel. All of it has a disposable towel. Toothbrush, toothpaste. It is tailored for one-time use. After doing this for long enough, we realized that giving somebody who is homeless a deodorant on this side goes in the garbage. A soap this side goes in. Even a toothpaste this side, it goes in the garbage. So over the years of doing this, we have been able to find distributors who would give us sell us things that are one-time, or toothpaste, one-time use, or toothbrushes, one-time use, our face cloth, one-time use, our towels are disposable, one-time use. The t-shirts, pretty much one-time use. We only do showers once in a location per week or maximum twice. And so we don't have abuse of the system or people coming every, no, we don't. And most times people who are homeless do not travel outside of their comfort zone. And so if you're even 2 blocks up the street, only a few guys are going to travel 2 blocks because they're not going to go out of their comfort zone. And experience has shown us that. And so that's our statistics of what we have been doing in pretty much New York and Connecticut. New Jersey, we have served on community give back days. A church have an outreach or community, they call us, we go. But we normally don't do too many showers when we do community give back days. We do quite a few of those here in the Bronx, but we want to go into the model that we have been using over the last couple of years, full time in the Bronx, because we see the folks who are presenting here. Most of the guys are not going to come to them because they're dirty. Just the nature. But once we give them a shower, we make a referral. And 90% of the time, it goes through. Because they are clean. They have built relationship with us. So if I tell you, and in New Haven, one of the benefits we have is that on site, we have Yale University that has a health van with us. And on other days, we have Cornell Scott Healthcare that has a health van. And so referrals are done easily. We got case workers. And so people tend to move easily back into using the available resources. Our showers, the pictures you see is our shower units. It is the size of your shower in your house. Most of you here, I could brag and boast that my showers in my trailer or in my shower tank is better than what you got at home. And I feel good about that because after all of these years of building it, maintaining it, of keeping it, they're still in prestige condition. The one to the extreme, well, the one that you're seeing right now is our pretty much handicap, and so it's bigger. It has a seat in the shower and enough room for somebody to roll themselves in. There's a ramp on this trailer. This one is a trailer, and they can go in and they can do their stuff themselves in this room. The others are the one that you see to the back of this one over here, and a little bit smaller. 32 by 32 is the size, which is the size of your biggest shower in your house. And so we thought in designing these, we thought about those who are pretty much on the heavy side. We also think about those who are on the high side. And for me, I don't like water coming into my face. So I always like my shower heads to be high, so water comes down on me. And that's one of the things that I do when we design and build these, that the shower heads are high and come down. A research was done 2 years ago by the Southern University of Connecticut. And one of the things I learned was how many of the guests used the showers for therapy. It was amazing for the pain in their back, the pain of their ribs, their back, and all, So a lot of folks use it for therapy, and one of the reasons is that we do use high pressure pump, and so you don't have trickle water. You have high pressure water that you get your shower with, and also the high pressure water is one of the things that we do inside there. And there's a time limit. Some people ask, yes, there's a time limit of how long you can you're allowed to stay in the showers. We have on-demand hot water, so we are never out of hot water. So don't think you can exhaust our water source, because most of the time when we travel, well, not in New York, but in other areas that we work, we do carry the water with us. And we only, we could only carry 275 gallons. If it's a Tuesday morning, it's going to do about 20 people, or 15 people. If it's a Friday morning, it's going to do 30 people. If it's a Thursday afternoon, it's going to do maybe the same 15. It just depends, because the traffic flow is different. And in the morning, the guys have to shave. They got to do, and shaving takes a lot of water, And so we make allowance for things like that. Well, that's our the low one is the trailer that we use in New Haven. The top picture is when we rolled out the staff of New Haven and my staff, the folks. After every shower, the showers are detailed. Every shower. There is no exception to the rule. Maybe 1 or 2 cases where we have family members together, and they kind of say, okay, I'll go right in after my girlfriend or my wife. Sometimes we allow that, but we don't make that a habit, because one of the things that I'm very, very meticulous about, that you must be able to go in and shower without your shoe, and I must be able to go in and shower feel comfortable. Okay, and if I'm not going to do it, I don't want you to do it. Secondly, the stigma of most of the folks that we deal with all come from incarceration, being kicked out several times. And that's what we got first when we went out. It's like, oh, do you have slippers? Do you have this? Do you have that? I say, you don't need it. And they say, well, I'm not going to go in. I say, if you go in and anything happens to you, we're fully responsible for you. But I can assure you that you're okay to go, and they all would go in and come back out changed, transformed. Tell their friends, come over. You got to come and enjoy this. And that's what, as you see, that's the ramp that we have for our first unit, where you can hold yourself into the unit. It's air conditioned, it's heated. For our operational time, we don't do more than 5 hours at any one place. Our maximum really is 4. But sometimes we, like in New Haven, and I'll say 5, because we switched, because we wanted 3 hours at one place, which 4 was not going to be too much. But one place we needed 5 because the numbers were more. But we normally say we do 4 hours per location. Within 4 hours, we could do the maximum of 30 to 35 individuals who go in and take shower. I could tell you, I could do 35 Latinos at any one location in 4 hours. I would do 20 or 15 blacks in the same location with less water. And for the Caucasian, I'll do about 20. Because our stats shows us that. The Latinos going, bam, 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 twice they're out. But when we go to other areas that we're dealing with, blacks and Caucasians, our water was like zing, because they take a longer time to take shows. So these are the things that we document. The weather. If it's a hot day, a rainy day, we document that. All the statistics we put together, and we use that to better serve our folks. It takes us about an hour, less than an hour, to set up the unit and have it functional. And we do, and so pretty much it's about an 8-hour day for the driver that leaves the storage area to get to the location, set up, serve for that hour, and then to go back. Pretty much that, these are some of the folks that we have been working with over the last 5 years in New York and also in Connecticut. We are based in the Bronx, just in case you're wondering. Our office is at 1951 Given Avenue, or pretty much 33 Edson Avenue, same location. We do provide showers at our office when we are not mobile. So the unit is parked outside of our office, and on Tuesdays, Thursdays, and Sundays, folks can come and take a shower. We ask that people call because we don't have a long line, but we do have people who come. A lot of folks that live in their cars and have rooming, don't have access to showers. They call, they come to take a shower. If I'm at the office, or if Jillian, who I did not introduce, who works with me in New York on this, we are more than happy at times to open for somebody to get a shower. If we're not, if it's not a shower day and somebody call and I'm there, I'll say, come along, get your shower and go. Because we are about serving the people, not about the time, but making sure that folks are happy and they get their showers. This picture is one of those that we did in a give back day in the Bronx. Last year we worked with a couple of organizations. They were promoting us as we were helping to provide showers in the community there, I think in North Haven area, yes, over here last year. Yeah, that's the truck. Let me see. Okay, that's another location that we again was part of the community give back program to the city when we are called. As I say, we'll go. We don't do 30 or 40 showers when you give a give back. People don't come to your shower because you think they need a shower. People come to shower because of a relationship. And so we'll have to go to that location consistently every Tuesday for 4 hours. They will come, they will look at it, but they will not go into it until they trust you. Then, and once they get into it and news spread, then it becomes easier for others now because it is new. Mobile showers is not something you find in New York City or in the Northeast. And what we roll, you do not find anywhere around here for miles. We're the only one I could say for sure is the only one that runs a program like this anywhere in the Northeast. Nothing like this at all around. I've done my research, and there are other folks that have done showers, but not to the extent that we do. Our organization is vetted, so we work right up from local, grassroots, right to the federal government. And so we have been sponsored by the HUD and other grants that are available. And so we are vetted. So we our main focus for power in the shower is community groups and government. Showers of Blessing, which I also operate for my church, we focus more on the church side of it and the religious part of it, of churches who want that. We go through that route. Let me flip to the next one. And pretty much this brings us, the rest of it, as I told you, is a detailed, what we call research was done on what we do by the Southern Connecticut State University. They had nothing to do with us. So the only time I knew them was from the time they showed up and started introduce themselves. They got a grant, and their responsibility was to survey us to see what impact what we do have on the community. And they can use that now for research because it has never been done. And so at universities and for caseworkers, and that now that stats is being used for public showers and toilets, and that was done in September of last year. For a full month, they came, asked those who wanted to, questions about the services, how they knew about it, how did it impact their lives, and they talked to the workers who work there. Access to toilets and showers is a human right, and these are some of the stuff that they talked about. Then this pretty much talks about the statistics. The public evaluation of September 2023. They asked 20 open-ended questions, and it went on to talk about the percentage. Where did you sleep last night? 58 slept in a shelter, 42 slept outside. 10% of participants reported that there was no shower in the place where they slept last night. And you know the statistics here. I made this presentation last week, and somebody sent me back and said there are over 5,000 unhoused and homeless on the streets of New York, with just less than 100 or less than 50 places where folks can go without being questioned to get a shower. And so we know that what we do is totally different, but we know it's something that our community is in dire need of. I've lived here for 30-something years, and I start seeing people, homeless individuals who are now sleeping in the park right across from where I live. When I go to work in the morning, there are people who are sleeping down on the sidewalk by the McDonald's. So I know firsthand, and I have given out this blanket before I had my organization. I used to drive around in my car, my truck. I used to carry these in my truck and give them to the guys that sleep in the parks around here by the Catholic church just down the street. And so we used to give the blankets out, and still would continue, with part of what we do now with our organization is to provide blankets for those who need blankets. And pretty much this to talk about the stats. This is what they gave us, and I'm just going to wrap it up here so that you can ask any questions you want. This is what the percentage 4.8 out of 5 for satisfaction with the showers. Cleanliness is 4.9 out of 10. Temperature, pressure, time, locations, clothing, supplies, and everything. In all our stalls, we have shampoo, bath, wash, and lotion in all of our stalls. And that's pretty much the towels. Most people kind of not happy with the disposable towels, but experience has shown me that the washing of the other towels was really time consuming when I started, and it was expensive. And so and I'll just share with you guys. When I started, a box of 200 towels was $30. When I did my RFP, I charged, I said $30, actually $35 or $40 for inflation. Within 6 months of starting, it went up to $80, and within less than a year, it was $100. Now, at one time, we were paying $140 for the same box. Thank God it has dropped down to $105. Okay, each recipient gets 2 towels, one to dry and one to put on a mat. And so after every cleaning, we put a towel on the floor so that they put before they could walk and as they step out.
Thank you so much. So we're gonna open it to the board, and this is our voting item. And you pretty much gave us a lot of information that we were probably gonna ask to begin with. Do you guys wanna ask any questions, or you guys wanna go straight to the voting?
I have one.
Yes.
How many people can take a shower at once? Like, how many people
Within an
would
hour?
it accommodate?
The unit that we have in the city has three showers in it. And so 3 people can take a shower.
At the same
At
time,
the same time.
but they're not like near each other or.
It's, every cubicle has a door
Yeah.
that it goes into. So when you go in, we write your name on a pad at the door and the time that you go in. And so when we are addressing you, we always can address you by your name. So we know who's in shower number 1, shower number 2, shower number 3. You get your time to shower. If there's no line outside, we don't really stress you. We just check to make sure you're okay, you did not fall asleep, which we do have quite a few people who do that after a shower, but pretty much that's all. It's a enclosed area.
I just have a it's just a curiosity question. How do you clean them between, like, is there
my
a
question.
cleaner in there that?
How you clean out?
Like, how do you clean?
Clorox.
Shower?
Clorox. What do you clean out?
Well,
It's homeless.
You got brush on the stick, that's what.
yeah, we have brush, we have, I mean, in the height of the
But
pan,
it's in between each person.
Every
right?
shower,
Like, so
every
as
shower.
they come out, and you go in and you just power clean it, and then they come out.
You throw some bleach up there on that brush, you know?
we have to use soap as well, because, I mean, you wouldn't want to see more of the dirt that could be on the thing when somebody hasn't showered for 3 weeks or 4
Or
weeks.
maybe longer, right?
Or maybe longer. And some people, they have, do their wipe down in November, but they're not gonna have a shower until we return in March or
So that's a lot of cleaning time between things too.
but within 5 to 10 minutes, it is fully clean.
That's
And
right.
so every week, every other week, we do a full purging of it. But if you were to check these showers right now, they're all
That's
squeaky
amazing. No,
white.
that's amazing. And I'm sorry, I'm not so clear on this isn't a question to you, I apologize. I'm not clear on the voting item.
So the letter of support for public funding or to the seeking support from members of the Bronx Community for One to serving the homeless unhoused individuals living in the Mott and Port Morris
Right.
or Melrose sections of the Bronx.
Oh, it's for asking for
Funding.
grants and
Right.
funding.
It's a support.
A letter of support.
Because I'm really surprised that the Department of Homelessness Services wouldn't be really interested in, like, the city
They
departments.
have been interested, but New York is a big cruise ship.
Yeah.
And so even though I've been in talk with them, just before the rise of the migrant situation, we were in talk of bringing this on board and streamlining it. Actually, the truck that I have was designed specifically based on the questions that was discussed at that round table. And so that truck is designed, if there's a case worker that has a client that they're gonna meet who is in really tiny of a shower, that truck can show up at that location once it's pretty much within levels and provide a shower for that case, for that individual, because it's all self-contained. There's enough water in it to shower 5 or about 10
Because I
people.
would think it would be a great, especially for the groups that are going out and actually trying to do what you're doing too within the city, that city funding would be a big potential funder for
You
you.
pointed something out that's very important too. The fact that there are a lot of local agencies, right? And charities. And not often do we see someone from your organization or anyone who can come to support a caseworker when they're dealing with people who are in need of a shower. And so that's important, right? So that's something that we have to consider to provide that support, because maybe in the future, hopefully you will have more than just one mobile unit.
Oh, yeah, that's the plan, really.
That's the
I mean,
plan,
that's the
right.
plan is to, as I say, we have started with one and we have pilot the
Yeah.
program. So what I'm saying to you is that what we know this works.
Yeah.
The truck that we have was tailored for what we do, but our current truck doesn't cater for wheelchair access in New York.
And I think that's important.
So
too.
our next truck will
Yeah.
definitely, with funding, I mean, it's gonna cost over $300,000 to be able to put that
That
together.
was my next follow-up. Go ahead.
I was saying that, like, with the people that presented earlier, it would, the Lincoln Hospital.
And a hospital too,
Yeah, the
because that's
hospital
his
would
workers.
benefit, because like, for instance, now they're gonna be in Lincoln, they're gonna be closed, they're gonna have, Lincoln Hospital, I don't know if you guys been to the emergency room, they sleep here, like
Yeah.
half of them sleep
Yeah.
here. So that thing that would be a benefit, like, you know, they'll go into the drug recovery program and then they can get a shower.
With a linkage
Work
services.
Yeah,
Yeah.
yeah.
And that's why, well, a couple of times I did shows at 144, especially back here, because of, you know, the area. But one of the things that we would like is like to partner with Lincoln. Because, like, for instance, we have a contract with Hartford Healthcare. And so we go twice to, I think, to provide showers for their clients who comes, and doctors would definitely send their clients to get a shower in order for them to be able to treat them. I mean, so it goes hand in hand. A lot of people don't go. People, they know that they stink, but it's not because they want to. And so they don't go to get the service that they could get because they know the smell. Or when they get a shower, they just go say, oh, I gotta go to doctor appointment, or I gotta go to, and so we see more movement when we do that.
Yes, I have a question. Thank you. First of all, it's a great initiative.
is.
Absolutely. In terms of like a target population, that like there is like a just take a shower just for female and male.
Yeah,
It's just
everybody,
all
everybody,
of them. Everybody. It's
everybody.
not like okay, there is just the shower. The room is just for female.
No.
It is for now.
It's a cubicle that you go into. Just like at your home. The only thing it doesn't have a toilet in it. We don't do toilets.
As you know, like for the newcomers, like I just said, families coming like working with kids. So do you have those kind of experience?
Yeah, we don't have kids. We maybe might have it in New York, but we really don't, because a lot of time kids and mothers get housing and care. So we don't get a lot of that. We do get quite a few ladies, but we don't get much of that. We get more men. But if that were to happen, our trailer, the handicap, the idiot, is big enough to accommodate that situation. And our next truck that we would have on the streets here would then have a unit that would be big enough to do that.
Okay. Madam Chair, Mr. Harris, my question to you is: when you say partnership with Lincoln, in what sense? What do you mean?
Well, with Lincoln is that they would work with us.
In what sense, Mr. Harris?
It's providing the showers. And so they could fund us.
Providing the showers.
Yes.
Yeah,
so they could fund us to provide showers.
Or fund.
Yeah, they could fund us to provide
In
showers.
other words, money.
Yes,
Okay.
yes. And if even they don't have the money, is make us a part of your network.
Okay.
Referral. So you have clients, you know, we're going to be at this location at that time. That's what most hospitals do for them. So the police know where we are.
Yeah.
The caseworkers know where we are. The ER knows where we are. And so when they release somebody from the hospital, they will tell them, go to this location on Tuesday morning, and you could get a shower and clean clothes. If you just come out of incarceration, we get a lot of that.
Yeah.
When they drop them, they say, hey, they're gonna be here on Tuesday morning. You're gonna get clean clothes and you could be on your way.
Mr. Harris, do you have employees?
Yes.
Do you pay them, Mr. Harris?
Yes.
And the location is it's a truck, so it's everywhere around the Bronx.
Yes, but we establish, once we do this, we establish operating location. So like the board would, I had two locations that I presented. One here, 144, and there's one over on 3rd Avenue, Willis over there. But Community Board 4 say, they are all in Community Board 1.
Okay.
But it is all in District 16.
Thank you, sir.
Okay, so when that is established, the community will say, well, this location is a little bit better because your location better than I do.
Thank you, Chair. So I'm gonna be the statistics. Let's talk about numbers. You talked about on average per 6 shower, they come in, they use X amount of water, X amount of supplies and materials they receive. Have you averaged what is the cost for one person to take a shower? What is the total cost per person to take a shower?
The average cost per person to just for the shower is
Shower including supplies. You use soap, you're gonna use shampoo, you're gonna use underclothes and everything else. What is the total cost per person?
The total cost per person is about $56.
$56 for one shower. And the average person spends how much time in the shower, or because I'm assuming you're timing it in order to do the budget.
As I say, it varies. We give you 10 minutes.
So 10 minutes to take a shower, $56 times how many people are allowed to take a shower in a machine that has full of water ready at a site setup.
I said we could do. I said again, if everybody's rolling on the schedule, we have done up to 35, but we say 30 within 4 hours.
And when you have done examples of this and other places, what are some organizations you have already partnered with? That are in the city of New York?
Well, we have partnered with the Adventist Community Services.
I'm sorry?
Adventist Community Services. Our longest area of providing showers for me, I started in 2019 at Catholic Workers, Joseph House, and at 34 East 1st Street in Manhattan. And I still go there every first Saturday, begin in April until November.
So April, November, $56, 30 people per at one session. They would do showers, usually mostly men and or single men, single women, not families. Correct? That's the details that you're providing. Where have what and so you talked about communities in Community Book One, where we represent oversee Port Morris, Mott Haven, and Melrose sections of the Bronx. Where have you identified that these services in those communities could be most useful, and what organizations have you thought to link it with? You talked about Lincoln, which oversees a large part of my portfolio, if not more, my entire portfolio. What areas in Port Morris, Mott Haven, and Melrose would you ideally say that your program is needed?
Well, I have done with a church at 144 right over here, and also with a church over at 3rd Avenue. And I've done that on and off.
Right. So like this is when you get a chance, when you reach out to the board in writing, it's what specific addresses and what the specific names are.
I didn't say that to you, but
no, when you do, I'm just asking that now. When you reach out, please follow up.
As I said, I did that, but I did send that to the board.
Right.
But those are the ones that I have done by saying, if you know of better areas that it can better serve, then you would direct me to be able to do that, because for us, we want to serve the most people possible with the resources that
I want to get my questions out because I have a little bit of time. Okay. So the next questions are what buckets of funding are you looking for? Are you looking foundations, city council discretionary dollars? Where are you looking for funding? Exactly.
Well, my first approach was Council Stevens discretionary funding.
And Councilmember Thea Stevenson, or where?
Thea Stevenson.
And whatever council members.
I have not targeted any other council member at this time.
Right. This because the time is of the essence, and the deadline for discretionary dollars is fast approaching.
Yes.
I want to. The next thing I wanted to ask is how you said $300,000. Is this for the truck, including the machinery and everything?
Yes. Correct? If I were to.
What is the total cost you spend on staffing right now?
I guess I think it was like 60% of my operation cost, well not 60, little less than that, is in staffing.
60% of the cost now are in staffing.
Most of it, yeah.
Thank you, Chair.
And so what would the total operating cost be
for
a year?
For the year, what's your total our annual budget?
Well, my again, it depends on how many locations that we do. So if I were to say right now, we do it 3 days a week, 4 hours a location. We are going at $1,900 per day to operate.
So what's your annual budget, would you say?
For
operating annual budget. If you would have said to the, if I'm sitting here with a check in my pocket, I want you to operate for 1 year. What do you need to check?
That would be about $185,000.
Thank you, Chair.
Yeah. Would it be possible to give us like a breakdown for the board meeting?
Yeah, in writing.
A budget, because the thing about it is like, we wanna support, but we're gonna have, for the board meeting, we do have people in the community that are gonna be asking, what that vision is gonna look like in terms of the budget and your expectations and the projections of it. So I think it will be best to give us like a overview of a budget of what that is gonna be, so that the board can actually, partake and support it. Are we gonna vote? Oh, I'm sorry, Francis, I can't see you.
Yeah, because what you said was very interesting. Because go back, you mentioned politicians.
Yeah.
And you talk about the homeless.
Mhm.
Well, the intake center for the whole city of New York is only one. It's
Mhm.
located in this district up on the
It is.
hill, 138th area.
Mhm.
And
But,
then,
yeah.
then you talk about so that means that homelessness is an emergency. It is.
Yeah,
FEMA
Mhm.
has trailers parked there,
No, yeah.
sitting there for an emergency,
But you don't have
and they're
to
being
You can say
vandalized.
abstain if you want.
Our own taxpayers' money pays for this. And none of these senators and Congress people, because I know this for a fact, we got a whole lot of municipalities in New York State and outside of the state giving their homeless people one-way tickets to New York City. Because New York City is the only city in the whole country that says somebody is homeless near a place, there's some right there, that shelter right there. It goes to hard situation right there while we have all these folks out here in the street. I see this while he's going to jazz concerts upstate and out down there in Pennsylvania. And what they be doing out the people locals be talking about. Well, getting to that fact, FEMA and these two giant U.S. senators and the Congress people, FEMA supposed to be reaching out to you, period. Because that's our money right there to address this particular situation. Because I remember somebody at the city council came up that years ago, then got dropped.
Well, see, one of the big difference, again,
Yes.
I have been doing this because it's what I feel I was called to do.
Yeah.
There are people who have done it or tried to do it because they were trying to make money out of it. There's two differences altogether.
Right.
And so I'm serving people because I'm a disaster response specialist. I do that for my organization. And so I respond to disasters all over the, and me and FEMA have sent me to South Pacific, different places to repair. So I work. The difference is we cater to people, not money.
Yeah.
But in order to cater to people, we need money.
Yeah.
Yeah.
So we appreciate your time. We really do. And I understand that we do have this for a lot of, you're requesting for a lot of support. So what we're gonna do is we're gonna hold off, because there's some conditions to it. We have a meeting on the 27th, the board meeting, and we want you to come back because we want clarification on what that budget is gonna look like. And then also where we wanna give a sense of clarification of any organizations that you have worked with and those that you have not, so that we can be able to provide you that proper support. Okay?
Not a problem.
Yeah. You guys are all in agreement with that?
Fully, yes.
All right. Okay.
Fully.
All right. Huh? Okay. Thank you so much. Thank you. Do you have a business card or anything?
That's great.
Thank you, Mama. I appreciate that.
Wow.
It was very
Si le
informative.
botan de la casa ya saben
Oh,
qué.
there's also a picture of the,
Pero por
the
continuar,
showers.
claro.
No,
Claro, que continúa con su servicio.
tiene que tener todo.
Claro.
Eso es lo que dijo la chica.
Claro, tiene que estar un
Para la próxima vez.
No.
Pero nada,
Jabón.
si le botan de la
All right,
casa,
guys.
vaya allá donde
Ah,
sea.
We're almost
Para mí
done.
es un poquito raro.
Oh, I'm sorry.
Un poquito raro lo que estaba hablando.
All right. So really quick, I know we're about to end the meeting shortly, but we moved the new business earlier on because we had all these amazing presentations.
Yeah.
Yeah, wasn't it informative? Yes, I love it.
Yeah.
And so what we're gonna do is push the new business to now, and we're gonna discuss any future planning that we are trying to brainstorm for health fairs, any collaborations, any idea of possibly inviting other organizations and program of outpatient, inpatient, etc. And so I just want to open to you all of any brainstorming and plans that maybe we can have in place. I do know that we have the youth event in April, and we want to also brainstorm to see when is our next health fair, I guess, or our first health fair that we've been trying to do. So I'll open the floor and you guys let me know what you guys think. Yay, nay, what's the idea?
I have a quick question.
Yeah, you can answer that.
So, and I want to add to that because so of course, as Lincoln Hospital is aware, we have a new executive team that's
Yes.
joining the
Thank you
hospital.
again. Thank you.
And so-
Thank
you. And so while we're looking at the new executive team at the hospital, the hospital's executive team has a strong emphasis in ensuring that they have a real community impact in the community and in a way that energizes the work that Lincoln Hospital has been doing, working on focusing on so many health issues that have impacted our community. The chair of the full board and the chair of the Health and Human Services Committee soon will be meeting with the executive team of Lincoln, including all the chairs of the different Lincoln Hospital departments, the executive director, the chief of staff, to talk about how do we look at the future of this facility, but also how we are looking at health period for community
Yeah.
Ward 1. My Haven, Port North, and Maryville, as you know, was impacted very largely with, from deaths and other long conditions regarding COVID, and has suffered so many issues as it relates to flu and other respiratory illnesses. And as we look at other issues that have not been looked at, like autism, and vaccinations, ensuring that we have a health, obesity, other environmental health related issues. So this committee board has an opportunity now to take the strong, engaging staff of public health education and with all the things that are going on in this hospital and really challenge this executive team and administration to say, where is the hospital going to be doing to not only just deal with chronic emergency conditions, but what are we going to be doing to face the issues that have been impacting this community for a long period of time?
Yeah.
What has COVID taught us? And because all we've been doing is adding services that has been dealing with around substance abuse and so on, but now with solutions dealing with asthma, long-term respiratory. Give me 1 second here, Herman. Looking at so many of these issues as we looked at how our housing is designed, how we're looking at so many of these issues. So I say that because the chair has challenged us to say we just can't be a committee that have presentations that are going to be recorded. So what are we going to be doing to really talk to the administration? We have a mayor election is coming on to say what do we want to be looking at health-wise for our community, and what changes? What are we going to be doing? What are we going to be challenging our community to do more? What is the standard of health? Here we go for health prevention and eradicating some of the health illnesses that have been in place. Because we look at what's happening in the federal government. We have a Secretary of Health and Human Services that is looking at how they're looking at health and access to health resources in a totally different way. That's 4 years of looking at how that's going to definitely impact. So these are conversations we need to be having to say, what are we not going to tolerate? What do we want more of? What are we going to be resources of? What are we going to be dedicating? Because if not, the community people will come, the administration will come and say, here's what we're giving you guys, instead of what we saying, this is what we demand, what we need. And so the forward thinking of this is that the chair of this committee and you all who are colleagues of this, not just folks who are hearing presentations, but setting policy, setting standards, setting what we want to do. Our colleague Jacqueline has really, for personal reasons I can share, has really been focusing on what are our public parks doing to provide public play spaces for young people with autism in a way that really meets a need that kids unfortunately have to do this, all these resources at school or at home because there's nowhere publicly outside and open that is available. We have been in lack of for a little over 5 years of not having a recreational center So there's no really social activity place that's safe
Mhm.
for our young people to get engaged. Senior citizens have to pay to go to YMCA to have access to quality stuff, which is so good. So all those things are stuff for us to forward think of. So I think the chair for what it's doing is that for you guys to go home, brainstorm, challenge yourself mentally, and saying, what do we need to be doing as a board? So when we come back, as we start looking at reappointments and so on, what are we doing as a committee to say these are the standards, this is what we need, this is what we want for our committee? Thank you, Chair.
I have,
And also I wanted to add and to address the health disparity.
Yeah.
Because what happens in this community and what we see in this community is not what Manhattan is seeing or other affluent areas. And we need to make sure that those disparities, we close the gap on those disparities.
I agree.
yeah, can I say something like, just for the last 10 years, Lincoln has a lot of experience working with that, specifically with the health component disparities. For example, last year, we just invited to all internal departments, like a stroke department, nutrition department, the cancer department, the women's health clinic. So we divided like in clinics. And another section was like home care agencies, another were churches, another senior centers. I think we have all that. The only thing I think we had to sit down and how we're gonna set up because through our experience, and also we use the patio or you use the gray lawns. Yes,
So I was gonna say something. So, I'm a advocate for kids who are on the spectrum. Last year, I'm part of a church, a City of Refuge. We have an organization called Helping Hands, and we also have City Life, which we do a lot of community events. Right now, we're hosting autism walk for April 19th in St. Mary's Park. Last year we did it, just tried it out, didn't make a big deal, didn't really, just word of mouth. And we had over 100 people come and show up.
Wow.
This year we're doing it again, but we want to partner with the community board and whoever else because we notice it's something in our area. I'm a mom, my son is 13. He has autism. I go to Jersey City, but I know a lot of people in the area. I grew up in 146. I'm always around 146. There's no services. Batanzas, my son got kicked out of Batanzas because they weren't really equipped to deal with it. St. Mary's, the same thing. So where do our kids go? We in a poor area, a lot of these kids are being raised by grandparents. A lot of these kids, their parents are, disabled themselves. They can't travel. So it's like, things like this is what we need. And like they said, I'm always fighting about that. I'm tired of being in meetings and talking about it. So it's like, now, okay, what are we going to do?
What are we going to do, yeah?
So I work full time, but I still, my little time that I have when I'm not in church, like I go up there. We had, again, our organization, Helping Hands, we do weekly, like monthly podcasts where we host information night. We have OPWD, they come. We have different schools that come. We have like different clinics. Because again, a lot of people don't know, how do I start?
exactly.
How do I do it? It's me. My son is 13. He was diagnosed with 6. I still go through it. I still have this lack of resources in our area. There's only this area particularly because again, we're the poorest section. If I go to Clark's next, I could get everything. My son, ABA, school bus, and all of this is not. But here, it's bad. Like, I literally had to do the steps myself to even get him within the school system. I had to go to the district to pick up an iPad because they wouldn't provide it for him. So it's like things like this that is something, it's a major, major issue that is like no one realizes a conversation is had. Like up to, wait, wow, it is an issue.
Exactly. Let me tell you, like what you mentioned is true because just for this particular area, but what I say, like almost 25 years working in Lincoln Hospital. So also during those events, we invite to agencies from different boroughs, just Queens. They come from Queens, Brooklyn, Manhattan. So in this case, I think Lincoln had like a strong relationship with many CBOs and CFOs. So the thing is like just I think the district manager. You mentioned like you spoke already with our CEO, Cristina Contreras, in saying like the internal departments can participate. And also we can invite to the medical facilities to be part of that event. Absolutely, and I totally agree with you. So the place should be when we can set up and looking for the place. Because I think it is a big event.
Yeah, and thank you, Marcel, for bringing up. We had this very passionate conversation. I did my one-on-one with the health committee chairs, doing a health symposium, conversations on where we were and where we are as far as sorry, as a health institution. And so because it is important, it's unfortunate that we are going everywhere outside of community for
But here,
everything, for shopping,
yeah,
for buying our food,
yeah.
for recreational, for our health, and for so many things. And I think that this is the opportunity to rebrand and set the standard for how we deal with health. We want to bring so the idea that we had in trouble with the chair is inviting not only Lincoln to host it, but inviting some of our private health institutions, Montefiore,
Yeah.
and because we want to challenge those institutions outside and maybe look at best practices, look at Linux Hill, look at so like you talk about outside the community, look at vegetarian, look at quality insurance, look at how we evaluate, and we don't want to privatize our the health system because there's a reason for a public health system because we want to provide access. Sometimes private health systems can't provide access, but we have to then still set that standard even for our human capital to say that we want to challenge them to in a positive way because it helps develop them in a way to be able to be to take extremely more pride in their profession as nurses, as doctors, as so on. Because we know that, I mean, I have these, Marcelo and I had, I think, almost a 2-hour conversation about it. Some of it was in leisure, but some of it was extremely to say how we have to look at language, how to look at religion, because some people, you know, I looked at a private health hospital and who serves the African community. That women who are African Muslim do not want a male doctor to examine them. They will prefer not to go to get looked at for a situation because the barrier that happens where you try to go and because of their religion and interact with a doctor who like to be male. So how do you provide someone who's sympathetic to that particular religion understanding to and invite more women of Islamic faith to be able to get breast cancer screenings? Men who are never interested in going to get a colonoscopy because something about that word scares them, or either a prostate exam it scares them all to death. Not only because they're of this them being examined that way, but just hearing the C word.
Yeah.
Can't anyone hear cancer? That is a scary piece. And also and how people need to understand real stories about dealing with obesity. No, obesity. It is a disease, in my opinion, because the reason why people usually eat or do it enough because it solves another situation that's going on in your life, either an abuse or something. And then the last big thing is mental health. No one wants to wants to deal with a mental health issue. For people who work in that field, you know already the stigma that attaches itself to mental illness, but your job could drive you crazy, to your whole life could drive you crazy, to this life could drive you crazy. So all those things is to say that that we had this conversation about a symposium that can be likely planned at the end of the summer.
Yeah.
Because we're off. We plan this out, spend all this time planning this now, getting people who are who look like us, who think like us, who come from our communities, but also outside of communities to come and have these conversations. And then we set the path forward for this institution, this mega institution that was born out of a radical movement of Black and Latino people who wanted to change the way that the public health system was serving the community. And so in a way, we need to be radical in ourselves and we born that again out of those ancestors, the Black Panthers and the Young Lords who came and wanted to change the public health system to do something to really change the way stuff and so on. And so our goal is together as a team that we have to start having these conversations. So I think, Chair, we should have these conversations about planning a little bit of time set for each of the upcoming meetings to see what that looks like. And I'm sure that we can encourage the executive staff of the hospital to want to lead and host that. Or like Marcelo said, there's so much space in this facility to be able to have those different conversations.
We can definitely, thank you, Anthony. We could definitely brainstorm and possibly have that agenda going in terms of partnering with Lincoln and also being able to provide services for autistic, you know, children, but also families who don't know that, you know, their child is, they're undiagnosed. So it's like, it's a long list of things because health is big. It's a big umbrella. It ties to everything. And so it's something that we are passionate about and we want to get the ball rolling. And yeah, it's been.
About something for September? So for now.
We said that last year. We said that
Either
last
August?
year.
Well, whatever.
We said that last year, nothing happened.
Well, it's up to you, Chair. You, this is
And
your,
I'm
this is
done.
she wants to do now. There we go. All right, nothing else, Chair. I don't know if you want to adjourn the meeting.
Yeah. We need to get the local politicians, because a bunch of mess jumping off here.
Absolutely.
I passed by the old Marcina building, where Marcina house used to be at. The building's vacant now.
Yeah.
But here's where it gets nasty.
Uh-oh.
New York State, right there on 161st Street, Washington Avenue, have that old youth jail there, which is empty. The city is presently negotiating with the state to buy it, to put youth in there. For what? Oh, yeah. And also the city negotiation with the state to get that old jailhouse down there at 110th Street in Harlem also. The resources is there, but it's going in the wrong direction. Instead of using this money for jailhouses, and also that building up the old Martin house used to be, it's vacant. It could be utilized for what we're talking about right here. But politicians, we got representatives, don't have the heart to do so.
I know that's right. All right. Well, I'm gonna adjourn. Yeah. Motion to adjourn.
Okay.
I make a motion to adjourn.
All right. Motion to adjourn. Thank you, Francis.
No, I'm run up on them.